Welcome students. Today I am going to discuss an interesting topic, that is coordination compounds and complexation. In this lecture, we are going to discuss some inorganic therapeutic agents which are used for medical treatment in metal poisoning, especially in the case of arsenic, mercury and lead. This is the chemistry of transition metals involving metals to some extent. Coordination complexes or metal complex consist of central atom or ion, which is usually metallic and is called the coordination center, and a surrounding array of bound molecules or ions that are in turn known as ligands or complexing agents. Many metal containing compounds, especially those of transition metals and coordination complexes. A coordination complex is the product of a Lewis acid-base reaction in which neutral molecules or anions bond to central matter atom by coordinate covalent bonds. Following are the points to be considered. Ligands are Lewis bases. They contain at least one pair of electrons to donate to a metal atom ion, also known as complexing agents. Metal atoms, ions, are Lewis acids. They can accept pair of electrons from Lewis bases. Within a ligand, the atom that is directly bonded to the metal atom ion is called as donor atom. A coordinate covalent bond is the covalent bond in which one atom supplies both the electrons. If the coordination complexes carries a net charges, the complex is called as complex ions. Compounds that contain a coordination complex are called coordinations compound. For example, FeCl4, AIF63, SnCl42 and PbI42 ions and CrCl3, 6NH3. Remember, coordination compounds and complexes are distinct chemical species. Their properties and behavior are different from metal atom or ions and the ligands from which they are composed. The coordination spheres of a coordination compounds or complex consist of the central metal atom or ion plus its attached ligands. The coordination sphere is usually enclosed in brackets when written in a formula. The coordination number is the number of donor atoms bonded to the central metal atom or ion. The chelate effect is the enhanced affinity of chelating ligands for a metal ion compared to the affinity of a collection of similar non-chelating ligands for the same metal. Homogeneous catalysts are often chelated complexes. A typical example is the ruthenium chloride chelated with BNAP, used in Noether asymmetric hydrogenation and asymmetric isomerism. It is used in manufacturing of synthetic methanol. Chelation in the intestinal tract is a cause of numerous interactions between drugs and metal ions. As examples, antibiotic drugs of the tetracycline and quinolone families are chelators of Fe2, Ca2 and Mg2+ ions. Also, citric acid is used to soften waters in soaps and laundry detergents. A common synthetic chelator is EDTA. Phosphonates are also well-known chelatic agents. Chelators are used in water treatment programs and specifically in steam engineering. Example, boiler water treatment system, chelate water treatment system. Metal chelates compounds are common compounds of fertilizers to provide micronutrients. These micronutrients are required for the health of the plants. Most fertilizers contain phosphate salts that in the absence of chelating agents typically convert these metals ions into insoluble solids that are of number nutritional values to the plants. EDTA is the typical chelating agent that keeps these metal ions in soluble form. Now, we are discussing very first inorganic chelating compound, that is penicillamine. Penicillamine is a chelating agent capable of forming soluble complexes with copper, iron, mercury, lead, gold and other metals. Penicillamine capsules are official in USP and sold under the trade name of cuprenil and dipin. It is a medication of chelator class available as D-penicillamine. Levoisomer of penicillamine is toxic in nature and inhibits the action of pyridoxine. It is an amino acid metabolite of penicillamine, but do not possess any antibiotic properties as penicillin. John Walsh was the first person who described the use of penicillamine in Wilson's disease in 1956. He had discovered the compound in the urine of patients who had taken penicillin and experimentally confirmed that it increased urinary copper excretion by chelation. In USP, it is described as official product. It is white or off-white crystalline powder having a slight characteristic odor. It is freely soluble in water and slightly soluble in alcohol. The pH of an aqueous solution is between 4.5 and 5.5. This agent has many medical uses. As a chelating agent in Wilson's disease, rare genetic disorder, copper metabolism, it binds to accumulate copper and eliminate through urine. In cystinuria, a hereditary disorder caused by formation of cystine stones, penicillamine binds with cystine to yield a mixed disulfide which is more soluble than cystine. It is used in treatment of scleroderma. It was the second line treatment for arsenic poisoning after dimercaprol, but it is no longer recommended. This drug may also be used to treat lead poisoning only if it has been prescribed by your healthcare professional. It helps to decrease pain, tenderness, swelling in the joints, decreases copper levels which improve liver function and the mental mood, nerve problems such as confusion, difficulty speaking, walking caused by the disease. As oral medication, it is used in excessive urinary excretion of the amino acid cysteine, excessive copper deposit in the liver and brain, treatment of kidney stones caused by cysteine, treatment of rheumatoid arthritis. It may also be used to treat inflammation of blood vessels with rheumatoid arthritis, arthritis with enlarged spleen, low white blood cell count. Penicillamine can be used as disease-modifying anti-rheumatic drug to treat severe active rheumatoid arthritis in patients who have failed to respond to an adequate trial of conventional therapy. Although it is rarely used today due to availability of TNF inhibitors and other agents such as tocilizumab and tofacitinib. Penicillamine works by reducing numbers of T lymphocytes, inhibiting macrophages functions, decreasing IL-1, decreasing rheumatoid factor and preventing collagen from cross-linking. It has a specific dose of administration. This medication can be taken by mouth on an empty stomach 1 hour before or 2 hours after the meal or as directed by doctor. Take this medication at least 1 hour apart from other drugs, especially antacids, meals or foods. Dosage is based on medical condition and response to the treatment. Doctor may also direct to take vitamin B6, pyridoxine and iron. If there is need to take iron or other products, that contain minerals such as zinc, take it at least 2 hours before or after taking penicillamine, since they may block the absorption of penicillamine. Penicillamine has adverse effects. Most common side effect includes occurring 20 to 30% of the patient treated with penicillamine, bone marrow suppression, dyspepsia, anorexia, vomiting, diarrhea. The other possible adverse effect includes nephropathy, hepatotoxicity, membranous glomerulonephritis, aplastic anemia, antibody-mediated myasthenia gravis and Lambert-Eaton myasthenic syndrome, which may persist even after its withdrawal. Drug-induced system lupus erythematosus, elastosis perforans serpiginosa, toxic myopathisis, and unwanted breast growth. The official product which is available of penicillamine is penicillamine capsule. Doses is prescribed as the usual oral dose is 250 mg given 4 times a day. Doses may be gradually increased on an individual basis to a maximum of 5 gram daily. Low copper diets or a cation exchange resin is frequently employed during therapy. Sulfurated potash has also been used in dosage of 40 mg to minimize the absorption of dietary copper. The preparation which is available by the Mark Sharp endowment is capsules called as B.Pharm capsules containing 250 mg of penicillamine for oral administration. The other drug which is used is dimercaprol. Certain heavy metals such as trivalent arsenic show their cellular toxicity when bind to the sulfahydryl groups present in the enzymes which are responsible for oxidation reduction reaction in tissues. Knowledge of this association lead to the idea of use of diethyl compounds as competitors with the enzymes for these metals might serve to prevent toxic reaction. Thus, subsequent work on this introduced the dimercaprol or called as BAL. It is an effective neutralizing agent for arsenical var gases such as lewisite and also used in treatment of mercury and gold poisoning. Dimercaprol is official in USP. This is colorless or almost colorless liquid having a disagreeable mercaptan-like odor. It is soluble in water, alcohol and benzyl benzoate. The medicinal use of dimercaprol includes the compound forms stable mercaptides of the metals which excreted in urine. It is used to treat gold and arsenic poisoning. It is also effective in treating mercury poisoning depending upon its use within a few hours following ingestion. Improve the excretion of lead and copper. The specification in this medication is that it is contraindicated in poisonings due to iron, cadmium or selenium because the resulting complexes have greater renal toxicity than free metals. In the treatment process, urine have to be alkalized with sodium bicarbonate to prevent the release of free metal causing renal toxicity. Dimercaprol side effects are: it is not given in the case of severe drowsiness, severe headache, severe nausea or vomiting, stomach pain, pain or pressure in your throat or chest, anxiety, restlessness, feeling, rapid heartbeats, pain, tingling or tight feeling in your hands, burning sensation in your mouth or throat, burning sensation in your penis, red or watery eyes, twitching eyelids, runny nose, increased salivation or signs of kidney problem, little or no urinating, painful or difficult urination, swelling in your feet or ankles, feeling tired or short of breath. The common side effects include weakness, headache, fever, or pain or hard lump where the medicines was injected. The official products which are available as dimercaprol injection, it is a solution of dimercaprol in mixture of benzyl benzoate and vegetable oil. The solution contains the equivalent of 100 mg of the compound in each ml. Doses includes or varies with the severity of the toxicity. In severe arsenic or gold poisoning, it is given intramuscularly. Injections of 3 mg per kg is given 6 times a day for 2 days, 4 times on 3rd day, then twice daily for the next 10 days. In case of mercury poisoning, 5 mg per kg initially within a few hours of ingestion, followed by 2.5 mg per kg twice daily for 10 days. Preparation of dimercaprol or BAL is BAL in oil solution containing 100 mg per ml in peanut oil for intramuscular injection. Another drug which is used as antidote or anti-poisoning agent is disodium edeate. Disodium edeate is used to chelate heavy metals and used in the treatment of heavy metal poisoning, especially in case of lead poisoning. It has advantages over other calcium chelates. It causes hypocalcemia during therapy. Hence, care should be taken. The primary use of the disodium edeate is conditions related to the hypercalcemia states. It is also useful in occlusive vascular disease and cardiac arrhythmias when associated with high blood levels of calcium. The description of drug is, it is white crystalline powder soluble in water providing an aqueous solution of pH between 4 and 6. The medical uses of this are in the treatment of heavy metal poisoning, in the treatment of lead poisoning, treatment of hypercalcemic state, treatment of occlusive vascular disease caused by high serum calcium, treatment of cardiac arrhythmias caused by high serum calcium. The side effect of disodium edeates are, it should not be given to the patient who are unable to urinate or having arteriosclerosis, that is hardening of the arteries. Care should be taken if the patient is allergic to any drugs or having heart disease, congestive heart failure, a heart rhythm disorder, a history of seizures, brain tumors or head injuries, diabetes, low potassium levels. If you take digitalis, these medications may be harmful to an unborn baby. Hence, discussion should be made if patient is pregnant before administering drug. It is not known whether drug passes into breast milk or if it could harm a nursing baby. Hence, care should be taken while breastfeeding a baby. The official products of this drug is sodium edeate injection. It contains varying amounts of the disodium and trisodium salts due to the effect of pH adjustment. The dose of these drugs include intravenous infusion of 50 mg per kg of the body weight dissolved in 500 ml isotonic sodium chloride or 5% dextrose. The infusion is done over a period of 3 to 4 hours once a day for 5 days. 2 or 3 therapeutic courses may be required. The preparation include enderate available in a solution containing 150 mg per ml for injection. The another and the foremost drug is calcium disodium edeate. Calcium disodium edeate is the calcium complex of the disodium salt of ethylene diamine tetraacetic acid, that is EDTA. It is used in the treatment of heavy metal poisoning and lead poisoning. It may be used in the treatment of poisoning due to copper, nickel, cadmium, zinc, chromium and manganese. It is totally ineffective in arsenic, gold and mercury poisoning. It has strong affinity towards calcium, hence avoided in the case of hypocalcemic patients. It chelates the lead from the tissues and forms an inactive soluble complex, which can be removed from the circulation by kidneys and excreted in the urine. It increases urine lead excretion by 40 times and poorly absorbed in gastrointestinal tract. It may be produce toxic reaction or aggravating, which in turns lead to the lead absorption in guts and establish the toxicity. The drug description is as follows. The compound is a mixture of the dihydrate and trihydrate, available as white crystalline granule or a white crystalline powder. It is odorless, slightly hygroscopic and has faint saline taste. It is stable in air, freely soluble in water and pH of aqueous solution is between 6.5 and 8.5. The medical uses of these drugs are intravenous EDTA is used to treat lead poisoning and brain damage caused by lead poisoning. It also treats poisonings by radioactive materials such as plutonium, thorium, uranium and strontium for removing copper in the patient with Wilson's disease. It is also used for treating high levels of calcium. EDTA is also used intravenously for heart and blood vessels conditions including irregular heartbeat due to exposure to chemicals called cardiac glycosides, hardening of the arteries, high blood pressure, high cholesterol and blood circulation problems such as intermittent coagulation and Raynaud's syndrome. Other intravenous uses include treatment of cancer, rheumatoid arthritis, osteoarthritis and eye conditions called macular degeneration, diabetes, Alzheimer's disease, multiple sclerosis, Parkinson disease and skin conditions including scleroderma and psoriasis. EDTA is sometimes used as ointment for skin irritation produced by metals such as chromium, nickel and copper. Eye drops containing EDTA are used to treat calcium deposit in eye. In foods, EDTA bound to iron is used to fortify grain-based products such as breakfast cereals and cereals bars. It is also used in calciums and sodium compounds to prevent food and to promote the color, texture and flavor of food. In manufacturing or manufacturing industries, EDTA is used in calcium and sodium compounds to improve stability in pharmaceutical product detergents, liquid soaps, shampoos, agriculture chemical sprays, oils, emulsions devices, contact lens cleansers and cosmetic. It is also used in certain blood collection tubes used by medical laboratories. The side effect of disodium calciums are immediate medical supervision required if patients have any signs of an allergic reactions like difficulty in breathing, swelling of face, lips, tongues or throat. It cannot be given to the patient in the condition of little or no urinating, a light-headed feeling like you might pass out, numbness or tingling feeling, pink or red urine, feeling very thirsty, fever, chills, pale skin, easy brushing. Iodate calcium disodium can have toxic effect in the body, which may cause life-threatening medical problems. A keen medical supervision is required at once if patients have memory problems, mood changes, trouble concentrating, changes in behavior or mental status, or if feel irritable. The common side effect may include pain where the medicine was injected, fever, chills, general ill feeling, tired feeling, muscles or joint pain, headache, tremors, nausea, vomiting, loss of appetite, sneezing, stuffy nose, watery eyes and mild skin rashes. The official product of this include calcium disodium edeate injection. It is official in USP, contain not less than 180 mg and not more than 220 mg of the compounds in each ml. It is employed in metal poisoning diagnosis and increase in the excretion of the metal in the urine is 500 microgram per liter for 24 hours or greater for lead. It is indicative of toxicity. The dose of this drug, intravenous infusion of 75 mg per kg of body weight in 2 divided dose per day, administered in 250 to 500 ml of isotonic sodium chloride or 5% dextrose. One course of treatment would normally last for 5 days with up to the 2 weeks interval between courses. Intramuscular injection of 75 mg per kg administered as a 20% solution in 0.5% to 1.5% procaine, which serves to nullify the pain associated with injection. The preparations include calcium disodium versinate. It is a solution containing 200 mg per ml of injection. These are the drugs which are used especially for the metal toxicity. Now, we had concluded this as a chelate is a chemical compound composed of a metal ion and a chelating agent. A chelating agent is a substance whose molecules can form several bonds to a single metal ion. In other words, a chelating agent is a multidentate ligand. An example of a simple chelating agent is ethylene diamine. Chelation is useful in applications such as providing nutritional supplements in chelation therapy to remove toxic metals from the body, as contrast agent in MRI scanning, in manufacturing using homogeneous catalyst and in fertilizers. Chelation therapy is the use of chelating agents to detoxify a patient's body of poisonous metal agents such as mercury, arsenic and lead by converting them to chemically inert form that can be excreted without further interaction with the body. Chelation using calcium disodium edeate has been approved by the US Food and Drug Administration, but only for the serious cases of lead poisoning. It is not approved for treating heavy metal toxicity. Chelate complex of gadolinium and often used are contrast agent in MRI scans. Organopins, a chelate complex of gold, is used in the treatment of rheumatoid arthritis. Although the practice has discredited and even condemned by organizations such as US National Institute of Health, the Journal of the American Medical Association and the New England Journal of Medicine, chelation was used as a treatment for autism. This practice has largely ended due to the absence of scientific plausibility, its potentially deadly side effects and the lack of approval the US Food and Drug Administration. Hope this lecture is beneficial for you and this regards. Enjoy the study and have a